In this video, students, let's complete some new drugs that have come into the market and they have been recently approved in 2024-25. So the first drug that we have here is datopotamab. Okay, this is a new drug. What is the target? The target is that it basically acts on the specific protein on cancer cells called as TROP2, and it releases a potent agent which is called as deruxtecan. So this deruxtecan, it kills the cells, right? What is the indication or where all it can be used? So the indication is that this drug can be used. It is approved for unresectable or metastatic HR positive, HER2 negative breast cancer and non-small cell lung cancer. So this is a new drug, datopotamab. This targets a specific protein on cancer cells called as TROP2, releases deruxtecan and causes. It is approved in the breast cancer and non-small cell lung cancer. The next drug which is approved is triosulfan. Okay, triosulfan is the second drug. Now it is basically an alkylating agent. Okay, where is it used? It is used in combination with fludarabine as preparative agent for allogenic hematopoietic stem cell transplantation, okay, for acute myeloid leukemia and myelodysplastic syndrome. Okay, so this is the new drug, triosulfan. Coming to the next drug, what is that? The next drug is suzetrigine. Okay, now what is suzetrigine? Suzetrigine is a selective inhibitor of NaV1.8, which is a voltage-gated sodium ion channel in peripheral sensory neurons. Okay, now this drug is used, it is basically as non-opioid analgesic, as an alternative to opioid medications in acute pain conditions. Okay, so this is the new drug, suzetrigine. Coming to the next drug, that is mirdametinib. Okay, now what is this mirdametinib? Mirdametinib is basically an inhibitor of mitogen activated protein kinases 1 and 2. Okay, what is the use? It is used to treat neurofibromatosis 1 with symptomatic plexiform neurofibromas which cannot be resected. Okay, so this is mirdametinib. Now after mirdametinib, the next drug that we have to see is, the next new drug is vimseltinib. Now what is vimseltinib? Vimseltinib is a kinase inhibitor and CSF1R antagonist. Okay, it is used to treat tenosynovial giant cell tumor. So this is the indication. It is specifically used in tumor which is not resectable, not operatable, and the tumor or when surgical removal can result in loss of function. Okay, so it is used in tenosynovial giant cell tumor, that is vimseltinib. The next drug that we see is gepotidacin. Now gepotidacin works by it inhibits the bacterial DNA replication, and this inhibition is by inhibiting the topoisomerase and DNA gyrase. Both these enzymes are inhibited. This drug is used in uncomplicated UTI in adult and pediatric patients more than 12 years of age. ठीक है, that is gepotidacin. The next drug we have is fitusiran, right? Now this drug fitusiran is a small interfering RNA therapy that is also written as siRNA, and it reduces the levels of antithrombin. Okay, now this is used to treat hemophilia A and B in adults and children aged more than 12 years. Okay, the next drug is, sorry, I'll take it on a separate page. Atrasentan. So this is the new drug atrasentan. Now this drug is basically an oral endothelin receptor antagonist. As you can see, the name resembles bosentan, antagonist, endothelin receptor antagonist. And what is its use? It is used in adults with primary immunoglobulin A nephropathy and to reduce the proteinuria. Okay, so this is the drug atrasentan. The next drug is penpulimab. So what is the use of this drug penpulimab? It is basically a humanized IgG1 PD1 receptor blocker. Okay, programmed death receptor blocker होता है ये, and this is used to treat recurrent or metastatic non-keratinizing nasopharyngeal carcinoma. Okay, this is the use of penpulimab. Another drug that we have is nipocalimab. What is the use of nipocalimab? Nipocalimab is a human IgG1 monoclonal antibody. It binds to neonatal FC receptor and causes reduction in the circulating IgG levels. It is used to treat generalized myasthenia gravis. Okay, this is the use of nipocalimab. Next drug that we have is avutometinib with defactinib. Okay, this is the drug, and this is basically a combination. Now, avutometinib is a nitrogen activated kinase 1 inhibitor, and defactinib is a focal adhesion kinase and proline rich tyrosine kinase 2 inhibitor. Okay, these are the two drugs and these are their actions, and they are used to treat KRAS mutated recurrent low grade serous ovarian cancer. Okay, so this is a combination of avutometinib and defactinib, right? The next drug that we have is telisotuzumab, right? Now this is basically an antibody drug conjugate. It is targeted against c-MET, which is a cell surface receptor, tyrosine kinase, and proto-oncogene. And this is used to treat locally advanced or metastatic non-squamous lung carcinoma. That is also called as non-small cell lung cancer. This is telisotuzumab. The next drug that we have is acaltremon. Now, what is this acaltremon? Acaltremon is an agonist of transient receptor potential melastatin 8 receptor. It is a receptor which responds to temperature changes. Okay, and it is used to treat dry eye, right? Another drug is clesrovimab. Now, what is this clesrovimab? This basically targets the fusion F protein of RSV, which is a key component to facilitate viral entry in human cell. ठीक है, and इसका यूज होता है, it is used to prevent respiratory syncytial virus, lower respiratory tract disease in neonates and infants. Okay, next drug that we have is garadacimab. Okay, now this garadacimab is basically a monoclonal antibody that inhibits the activated factor 12, and it is used to prevent attacks of hereditary angioedema. Okay, going to more antibiotics, more new drugs now. The next drug in this new drug series is dupilumab. Now some of the drugs we've already completed in the books, also rapid revision series also. Now this is a monoclonal antibody which acts against interleukin 4 and interleukin 13 signaling receptors. Okay, and what is the use? It is used, recently approved for use in CSU, that is chronic spontaneous urticaria. It is a condition causing intense itching and hives, and it is the first new targeted therapy for CSU in over a decade. The next drug that we have is NEET melanotide. Okay, now NEET melanotide is basically a melanocortin C4 receptor agonist. Okay, well, this is a key player in the control of appetite and energy balance, and it is approved for treating obesity due to Bardet-Biedl syndrome, which is a rare genetic disorder. Okay, next drug that we have is mirikizumab. Mirikizumab is basically a monoclonal antibody that binds to the interleukin 23. This drug is approved for moderate to severe Crohn's disease and moderate to severe ulcerative colitis, especially in those patients who have no response or are intolerant to the conventional therapy. Okay, then the next drug that we have is guselkumab. Right, now guselkumab is a monoclonal antibody against interleukin 23. This is also used in ulcerative colitis, psoriatic arthritis, and plaque psoriasis. Okay, the next drug that we have is adagrasib. This is basically a small molecule. It is used in the treatment of non-small cell lung carcinoma, and it basically inhibits the RAS G12C protein, which is involved in cell growth and proliferation. The next drug that we have is berotralstat. Now berotralstat is a once daily oral medication used in the treatment of hereditary angioedema in patients more than 12 years of age. It is a plasma kallikrein inhibitor. Right? Coming to the next drugs. What is wrong? Chalo. We have Vanza Caftor. इसी के दो तीन कंजीनर्स और हैं, टेजा कैफ्टोर and Duty-Vacaftor. Right? This is a component of triple combination CFTR modulator treatment. This is used to treat cystic fibrosis in children more than 6 years of age. Right? Now next drug that we have is lenacapavir, and this is basically an anti-retroviral medication used for HIV or AIDS. It is taken by oral route, or it can be taken by subcutaneous injection also. Okay. Next drug that we have is selpercatinib. Now selpercatinib is a RET kinase inhibitor. So basically RET receptor kinase mutated in cancer cells and provides them with growth signals. So it is used in cancers in people in which there is a genetic mutation. Okay. The next drug that we have is diazoxide choline. Now this is per se not a new drug because diazoxide is already being used. It is mainly used in hyperphagia, in Prader-Willi syndrome. Okay, this is the use of diazoxide choline. Then next drug we have is rivakinagene. Now rivakinagene is an allogenic encapsulated cell-based gene therapy, and it is indicated in the treatment of idiopathic macular telangiectasia type 2. Okay. Next drug is Mudela, and this Mudela is basically a intrauterine device which is used for prevention of pregnancy for 3 years. Okay, Mudela. The next drug is Phenodiol. Phenodiol is a synthetic form of bile acid phenodioxycholic acid, and this is basically used in the treatment of cerebrotendinous xanthomatosis in adults, right?